In this PowerPoint, we are going an overview how to examine and what are the findings of head and neck region. In here you can see what are the techniques we have to follow during head, neck, or integumentary system. First of all, inspection, what we can see through our eye, then palpate, then auscultate by stethoscope. The head and neck area basically consists of our skull and face, eyes and vision, ear and hearing, nose and sinuses, mouth and oropharynx. Before to start to focus head and neck area, here I'm going to little bit discuss the integumentary system. Because integumentary also in our head, neck, and sinus area as well. So integumentary system involve inspection and palpation of our skin, hair, and nail. To assessment of integumentary system, a general assessment of the skin begins at the initial contact with the patient and continue throughout the examination. Every system examination when we do, integumentary system will come first because of inspection and palpation. The specific area of the skin are assessed during the examination of other body systems unless the chief complaint is a dermatological problem. So let me talk about what are the subjective data or what are the objective data to find out what are the leading question we supposed to ask. Self-care behavior, subjective data. History of skin disease. Patient will explain, I have a dermatitis or I have a eczema last 5 years. Medication being taken because some medication can cause dermatitis, like medication-induced dermatitis. So medication history is important. Environmental or occupational hazard. Also, exposed to the toxic substance. So if a person work in a chemical industry, so his or her skin has a chance to expose to the chemical substance. Also, change the skin color or pigmentation. So why pigmentation is occur in my face? Maybe when you take the history, patient give a history of polycystic ovarian disease, shortly called PCOS. Unfortunately, the female has a pigmentation over the face, neck, or other part of the body. So I have a problem in any system, but it is reflects in my skin. My heart does not expel enough oxygen to the tissue. Cyanosis develop, right, over the mucous membrane or skin. So change in the skin color and pigmentation, change in the mole or change in the mole or soap that does not heal, means ulcer develop, or presence of tattoo also should included in the history, and it is a subjective data. What else? Objective data. We color change, temperature. Usually it is good to use dorsal aspect of hand when we measure the temperature. Is it hypo or hyperthermia? excessive dryness, or excessive sweating, moisture. Skin trigger, if my patient dehydrated, it reflect to the skin. Texture, smoothness, firmness, excessive bruising, right? So red spot, bruising, rash like petechia, ecchymosis, or hair loss, alopecia, or nail abnormalities such as pitting, koilonychia, leukonychia, some kind of lesion. It is good to include in the history. Integumentary system involve inspection and palpation of the skin, hair, and nail. When you inspect or when you palpate, we can see the different change, character of the skin color. If skin is blue, we call cyanosis. So malted bluish discoloration. If the skin is redness, we call erythema. If the skin is pale, whitish coloration, we call pallor. And pallor, why? Because of less oxygen supply to the skin or tissue. Maybe heart problem, maybe blood discrepancies. If the skin is yellow, patient develop jaundice. Jaundice is not a disease, it is a sign. Why jaundice? Maybe liver problem. So when we check the skin, we can find it out. Let me show you a picture. So here, this is the blue discoloration because of cyanosis. This baby boy, maybe the heart problem. Heart does not pump enough oxygen to the tissue, blue discoloration because of carbon dioxide. This you can see more prominent, the lips blue. This is the sclera because of jaundice, yellow discoloration. Here, this is a normal individual. This is a person who has a bilirubin is too high, hyperbilirubinemia, jaundice. Here you see eye showing the jaundice. This is erythema in the eye. Blood accumulate red color. So it is erythema. And here eyelid swelling because maybe kidney problem. So any problem, underlying structure, it can show up in the skin. Now go here, assessing capillary filling time. Repress the nail bed to proceed the blanching or release and observe for return the color. Color will return within 3 seconds if atrial capillary perfusion is normal. So we are talking about this capillary refill. So healthcare provider have to press for a time. Then after a few times, you have to withdraw your pressure and you can see how take time to rebate the blood to the nail bed. Capillary refill time. How to assessment? There are 3 steps. One, you have to put a pressure, press your finger on the patient's nail bed for 5 seconds. So count the time loudly. The patient's nail bed will turn white. The healthy person or disease, both can same thing happen. It should be turned white because blood supply should be arrested. Then you release the pressure. So wait a minute and wait for C. How long take time to rebate the pink or blood? So count the second till the patient nail bed turn to pink. So if patient is healthy, okay, it take only less than 3 seconds. Some books say 2 seconds. So if patient has any disorder or dehydration, it should take more than 2 seconds, right? So it means the patient has some problem. So capillary refill, NCLEX board like to ask the question from here. First of all, evaluation, normal findings, abnormal findings. Let me read it. We press on the patient nail bed until it becomes white, release and count the time until pink return. Normally, in 2 seconds or less. Abnormal if more than 2 seconds. Some book wrote 3 seconds. So 2 seconds or 3 seconds, both are correct. In the picture, this healthcare provider put pressure and pressure is applied to the nail bed until it turns white. Blood returns to the tissue in healthy cases. So here talking about this assessment, the capillary refill time. Next. Here what doing? Inspecting overall skin color, right? I can see the color. Is it pale? Is it yellow? Jaundice, anemia. So when you check, it is good to compare, contrast both hands. And it is good to compare with your hand to compare. And in this picture, this healthcare provider touching the skin by dorsal aspect of hand because need to assessment body temperature. Is it hypothermia or hyperthermia? What doing here? Palpating to assessment the skin trigger to see patient have any dehydration or not. In this picture, inspection the scalp and hair. So any alopecia means hair loss, any engorgement of the vein, any mass distribution. So test the skin tracker. Gently we pinch a large fold of skin and check the ability of the skin to return to its place when released. Poor tracker occur in severe dehydration or extreme weight loss. In this picture, so you see this area, it is when you put a pressure in again the bony area and after you withdraw, how long take time to reback it is. This is the way we check the edema in the legs. It is called pitting edema. So in this picture, you can see finger mild 1 plus. If moderate 2 plus. It is 3 means too much, severe 3 plus. So 1 plus means a barely precipitate pit or pitting edema is very mild. 2 plus rebound is a few seconds, deeper pit. 3 plus a deeper pit rebound 10 to 20 seconds. Here you see the first picture normal, but when you push the pressure over the malleolus bones and withdraw your pressure, it takes time to reback or reposition because of pitting edema. What is pitting edema? Fluid accumulate in the lower extremity, maybe heart problem, maybe liver problem, or any other disease. Next here. So now integumentary next. Dark skin client, We check for cyanosis, jaundice, bleeding, or inflammation. What is cyanosis, or where we should check it? We should check it over the lips or tongue, right? Or we can check the nail bed, hands, or sole for blue color, or conjunctiva for pallor, right? So blue discoloration is called cyanosis. Your tissue does not get enough oxygen. Jaundice, check the oral mucous membrane for a yellow color. Check the sclera nearest to the iris for yellow color, means bilirubin get up because of jaundice, because of liver problem. Bleeding tendency, look for the skin swelling or darkening. Compare affected side with unaffected side. Inflammation, check for temperature, shininess, pitting skin area, compare with the unaffected side. Usually, if inflammatory change occur, if you check it, you can get temperature high, swelling, tenderness, right, and pain. So how we re-educate, re-inform the client? So provide the information first. Information about what? About factors that can be harmful to the skin, such as the sun, encouraging performing self-examination of the skin monthly. Here, clinical bleeding symptoms. So if patient has underlying bleeding disorder, you can see petechia, purpura, ecchymosis, or hematoma. All of these are bleeding disorder. So petechia, like first picture, you see how small it is. This one, petechia. So petechia, pinpoint red spot look like. You see this picture? Very small, right? Usually 2 millimeter across. And ecchymosis, you see how big it is? It is larger, extra precision of the blood, more than 2 millimeter its areas. Ecchymosis, usually it is purple or purplish blue, fading on green, yellow, or brown with time. And usually it is rounded. Ecchymosis is rounded or oval or irregular. But petechia, others called purpura, you see this one. This is a purpura, little bit bigger. So petechia or purpura, it is deep red or reddish purple. And purpura is larger than petechia. Both are look like rounded and sometimes irregular and flat. So here showing why patients sometimes develop petechia, purpura, or ecchymosis or hematoma. Hematoma means blood is accumulated inside the tissue, maybe because of trauma or coagulation defect. So hemoptysis or primary plaque formation, blood clotting disorder, coagulation defect, thrombosis, thrombolysis, phlebitis. This is the few causes of bleeding disorder that is reflect in the skin, and skin is an integumentary system. This picture showing the inflammation, right? So what are the inflammatory change occur and reflect in our skin? Maybe something is happened, injured. After injury, redness, rubor, increase the temperature, calor, tremor, and dolor, or loss of function, right? This is the 5 sign of inflammation. So what are the 5 sign of inflammation? We can see in this picture, and you can get some ideas. So I said pain, redness, loss of function, and swelling. This is the sign of inflammation. And here I'm going to talk head, neck, and lymph node. So how we have to examine the lymph node? Because lymph node is a part of head and neck area. So involve inspection and palpation of the head, neck, and lymph nodes. So ask some question, leading question to the patient to get some clue what are the disease, like headache, episode of dizziness, vertigo, history of head injury, loss of consciousness, seizure, episode of neck pain, or limitation of range of motion, numbness, or tingling sensation in the shoulder, or arms, hands, lump or swelling the neck, difficulty of swallowing. Medication begins taken, history of surgery in head neck area. So ask the question, leading question to your patient to find out any problem in head area, neck area, or lymph node related. Now go in head area. When we check the head or skull, we have to inspect first, then go for palpate. Right? Because the head and neck examination is the portion of physical examination done to observe for sign of head or neck disease or any kind of illness or injuries. Or head and neck examination basically consists of inspection, palpation, and auscultation. First of all, we see the any kind of pathological mass, its size, shape, or any tenderness, symmetry of the skull. When we simply inspect, you see the face in the both side is symmetry or asymmetry. Is any mass present or not? The skin color is normal or not? The temporal artery we check located above the cheekbones between the eye and also top of the ear. Temporomandibular joint, a big joint in the head neck area, we have to check it. Check and ask to open the mouth. Examiner will look for any crepitation, any tenderness, or limited range of motion. Then we check the face, inspect facial structure for the shape, symmetry, involuntary movements, or swelling such as periorbital edema. Next, neck. Inspect for symmetry of accessories muscle involved or not during the inspiration or expiration. Also, we have to check it and check the range of motion, neck area movement up or down, side to side. So if it is movement without any problem, I said my patient has an active range of motion. We also check the cranial nerves, 11. It's called spinal accessories nerves. How we check it? Tested to check the muscle strength. And also the client is asked to rotate the head forcefully against the resistance applied to the side of the chin, right? We also check the trachea. Is it centrally placed or not? Then we palpate the trachea. Is it deviated in any one side? Because some respiratory problem, the trachea is deviated from the center. So it should be midline without any deviation. Then we go for thyroid glands. The neck is inspected as the client takes a sip of water or swallow. Palpation is done using an anterior and posterior view. Usually the normal adult thyroid cannot be palpated, and if it is enlarged, examine will auscultate for growing. So this picture, we can see a healthcare provider checking the head neck area from behind. So from the behind, it is checking the head neck area. So right hand here and left hand here. So let me go. Palpating area, here we say. So we, first of all, this is the trachea, right? And trachea, we can palpate. And it should be the midline without any kind of deviation left or right. But in the healthcare provider, the picture one, palpating the thyroid glands from posterior aspect. But in this picture, examiner palpate the thyroid from anterior view. First of all, we inspect the neck as the client takes a sip of water, and palpation is done using anterior and posterior aspect like this two picture, and usually thyroid cannot be palpated. But if patient has any thyroid toxicosis or goiter, we can feel it is enlarged. If we feel the thyroid is enlarged, then we can put the stethoscope for brewing. So here, the palpating the thyroid using posterior approach, picture number one. Picture two, using anterior approach. As I told you, usually it cannot be palpated. If thyroid gland is enlarged because of thyroid disorder, goiter, hydrotoxicosis, we put the stethoscope for ROI. It is the pathology. Now, let me talk about the lymph node. So, lymph node is also very important to check for the patient. And here, the examiner will palpate using a gentle pressure and a circular motion to the finger pad. Examiner will begin with pre-auricular lymph node first, then examine more posterior auricular lymph node, and then downward towards the supraclavicular lymph node. Palpate it with both hands. Compare two sides for symmetry or asymmetry. If node are palpate, their size, shape, location, mobility, consistency, and tenderness are noted. So in this picture, we see this is a chain of lymph node in our head and neck area. So a lymph node or lymph gland, whatever you want, you can say, it is very small and kidney-shaped organ of the lymphatic system. And also, and the adaptive immune system. This is the part of our immune systems. So a large number of lymph nodes are linked throughout the body by lymphatic vessels, right? Keep this note. They are the measured site of lymphocyte that include T cell or B cell. And you know that T cell or T lymphocyte or B lymphocyte is the first defense in our body. And the lymph nodes are very important for proper functioning of the immune systems, acting as a filter for foreign particles. Very important. Now I'm going to show you, first of all, we check for inspection. If any lymph node is really big, we can see it. Inspection. After that, we go for palpation. So this one called pre-auricle because it is in front of the ear. Particularly this bones is called tragus. Post-auricular means behind the ear, over the masted bones. And this is occipital, posterior to masted process at the base of skull. Then go here, submental. This is the submental, means inside the mentors of the mandible or floor of the mouth. Then submandibular, this one. It is near submandibular or salivary gland inside the oral cavity. And this one is called anterior cervical. This two is called posterior cervical. Both, and this one, third one, is called supraclavicular or supracervical lymph node. So all of together we call clavicular lymph node or clavicular chain. Anterior chain run along the, this one, anterior chain runs along the sternocleidomastoid muscle. It is along the pharynx or tonsil. Posterior chain, this one, run along the trapezius muscle here. And clavicular, they are abdomen, thorax, or breast drain. And supraclavicular, this one particularly, it is sometimes called Harkus node. Okay. So, what are the techniques we follow? The techniques means we use the pad of our finger or indicate or digital finger we use to move the skin in circular motion over the underlying tissue in each area. Palpate in the both sides of the neck simultaneously. If the small node less than 1 centimeter are normal unless is unusual location. So if we see any lymph node is enlarged, bigger in size, we always find out the location where it is, what the size, or is it mobile or fixed? What are the consistency? Is it soft? Is it hard? Is it firm? And also note the tenderness or non-tender. If the lymph node is non-tender, it means it is related to the cancer. If lymph node is tender, means with pain, it means the patient has an infection. So re-educate or reinforce the client teaching. The client is instructed to notify the healthcare provider if the persistent headache, dizziness, or neck pain occur. Swelling or lump are noted in the neck or head area. Also, neck or head injury occurs. Neck movement are never performed if the client has sustained the neck injury or neck injury is suspected. So a complete immobilization is the first priority if your patient has any injuries in the neck or head areas.